water quality and Ministry of Water Resources, the representatives, the United European Union and International State, representatives of UNESCO, Mr. TV, Emerging with Water, consultant for Strategic International Action Plan Council, and all the other relevant partners that are here today. And I think I do want to recognize you by name because it says a lot when you have a small room with this small very important number of actors that are here, ready to help Nigeria as a cultural representation and Nigeria. So this ceremony to actually get the purpose for this site savers, actually, First Aid, Plan International, the African Center for LSD, Nigerian Network, Connected Development, the National Science and Healthcare Development Agency, Federal Ministry of Environment, Federal Ministry of the Niger Delta, the Northeast Regional Initiative, the Provincial Office of the SPG, the Federal Minister of Water Resources, the Director of Water Quality and Sanitation again, the head of the National Action Plan Response, National Water Resources Institute, African Resource Council on Water, the World Bank, it goes on. The partners of the International Development DFID, African Development Bank, the European Union, USAID, the Association of Water Well Drilling Rig Owners and Practitioners, the Nigerian Water Suppliers Association, Borehole Drillers Association of Nigeria, Mayor Bobby Foundation Africa, the Dangote Foundation, Diageo Weaver, Procter and Gamble, Beckett Becketser, Standard Chartered Bank, GT Bank, Stanbic, IBTC, Nigerian Breweries, and Coca-Cola. And let me start by thanking Pind and WaterAid for inviting me to be here today. I started with the list of documents that are here today because I think the list of purpose that we made that time to come to this room pretty much accurately shows us the scale and the problem that we have in Nigeria and the people that it's going to take to close that problem. Let me start with the association with water drilling activities in Nigeria. As I look at the t-shirts from the WaterAid&Pind, their t-shirts say vote for water. And people already know people in this world. And we know what wash looks like. We know what wash looks like in a society where wash works. And I would first tell you that in a society where wash works, you don't see it. You don't see it because the dams are outside town and they already have their filtration systems. The pipes are underground. So the first thing has to be that you receive water sanitation and is when you open the tap and clean, drinkable water comes out of that tap. So what we have with us here in Nigeria, we've got the well engineers, we've got the borehole drillers and riggers, and a few politicians that decide to invest in wash do so by putting up an overhead tax so that everybody can see what they have done. But overhead tax are not the solution to bring clean water and therefore sanitation and hygiene to our communities around Nigeria and our 200 million people who need clean water to survive, to thrive, and to transform the future of our citizens. So I'll thank you again for this kind invitation. As stakeholders united in the belief that whoever you are and wherever you are, water is your human right. I believe that if we truly intend to leave no one behind, we must actually start with one toilet for all and ensure that after using that toilet, hand washing with soap will ensure clean hands for all. I will be working with the World Bank to work on its campaign in Nigeria to end open defecation, which stands at a rate of 25% and poses a serious sanitary hazard. Last November, the federal government of my beloved country launched its emergency response to our water and sanitation crisis. This has been stated as the first phase of the National Action Plan. At the Wellbeing Foundation Africa, we launched the Water Sanitation and Hygiene Campaign in May 2018 at the World Health Organization offices here in Abuja. We did so because of the overwhelming evidence that was coming back to us from our 576 locations of frontline healthcare programs that we had to go back and retrace our steps. That wash indices in Nigeria were not only poor, but they were worsening in many, many instances. Wash indices are often rightly discussed as statistical values. That is, of course, crucial to any national plan. And the Wellbeing Foundation Africa staunchly advocates for improved civil registration and vital statistics systems. We know that 1 out of 3 Nigerians does not have clean water close to home, and 2 in 3 do not have a decent household toilet. This contributes to the deaths of nearly 60,000 children under 5 each year from diarrheal illnesses caused by dirty water, poor sanitation, and very poor hygiene. Our Nigerian wash conditions kill more people annually in Nigeria than the number of people that have died from conflict with Boko Haram. According to WaterAid, our host here today, it also means a loss of 9% of our GDP, which is around $3.38, $3.3 billion a year. At the front line, these statistics are very, very real with the lives and deaths of our people. Women and infants are dying needlessly in neighborhoods with maternal sepsis, taking a mother's life at what should be the most joyous of times, because that neighborhood does not have a safe, clean water out of the tap and soap. Meanwhile, poor wash conditions also endanger infection prevention and control systems. The fact that outbreaks of diseases have been so severe in Nigeria recently led the WHO, who may serve as special advisor, commenting that the massive fever outbreak last year was unprecedented. That is no coincidence. This forum rightly wishes to highlight and analyze the importance of states buying into a national plan, but there are some potential pitfalls which we must be mindful to avoid. The first is any inclination to swiftly blame individual states for poor washing disease if they have not been allocated the funds, the expertise, and the support to improve them. Decentralization of responsibility is only reasonable if the states are adequately supported. Additionally, it is important to note that Nigeria is struggling to maintain its current infrastructure, inadequate as it is for the current population and entirely unfit for the years ahead. Our federal government must lead the way, and I believe is trying to lead the way, in achieving economies of scale in densely populated areas by providing piped water and not forcing individual families or streets to rely on their own resources. As the World Bank rightly highlights, this also allows for the proper regulation of groundwater, which is essential in the fight against pollution. This forum also wishes to promote collaboration between government, civil society organizations, and the private sector to provide this funding, and I would add also provide the expertise to dramatically improve wash indices. It is perhaps useful for me to share our own experience of these partnerships and the advocacy that can help to inform our actions at this stage. When we launched our washing campaign, our Medicare midwives, who were in 4 states and 576 locations, immediately began to advocate in healthcare facilities for better standards and taught proper hand washing techniques to staff. Their experiences informed our updated personal social health and economic education program in schools, teaching staff and students alike the importance of good wash standards. This is because we already have a framework in place and the trust of communities to adapt our programs to address the significant health risks quickly. But in a country of almost 200 million people, we knew that we had to reach far beyond our own program. And this is where the key relationships between frontline experience and the ability to improve capacity by achieving effective advocacy came in. When we launched the campaign last May, we announced that the foundation would work with partners, including Global Watch 2020, an initiative based in Washington, D.C., which is designed to accelerate progress towards water access and security for all people in all development countries, with particular focus on increasing the availability of wash in healthcare facilities. A key element of that partnership is advocating for improved wash standards, both in Nigeria and around the world. As special advisor to WHO at the regional office, I always strongly advocate for the WHO sepsis resolution to be adopted and implemented by all governments. In October 2018, the WHO then introduced new and pioneering guidelines for WASH in conjunction with neglected tropical diseases, which we are at risk of. The following month, we led a delegation to Washington to take part in multilateral meetings with the United States State Department, the World Bank, the Center for Strategic and International Studies, the American Academy of Sciences, and members of the United States Congress. That visit was intended as both an information gathering exercise and to engender a new spirit of cooperation on WASH. We were very happy afterwards that the USAID announced its e-wash program to bring clean water to 3 million Nigerians in 6 states. That visit was followed by 4 submissions to 2018 United Nations High-Level Political Forum on Sustainable Development. The intervention was made in relation to the forum event Partnerships that Deliver for Girls and Women, an interactive dialogue to break down silos and achieve the SDGs organized by Women Deliver. Following that intervention, Nigeria remedied the lack of priority that it was placing by putting in its approved WASH World Bank loan. So the money is now in place at the government level. In September 2018, we turned to the private sector and partnered with Unilever Lifebuoy Nigeria and Sightsavers to improve hygiene practices to impact more than 2 million children in their schools and communities over the next 12 months. The partnership works on a program which promotes hygiene messages and prevents disease, advancing hand washing with soap in schools. We are also providing these schools with platform water. So we are addressing the issues of child illnesses and mortality due to preventable diseases, and the 2 key diseases that we are preventing being diarrhea and also trachoma, which is a disease of the eye, which is very often ignored in the chain of hand washing. On the 25th of October 2018, we then called for a state of emergency to be announced in Nigeria on the status of water, sanitation, and hygiene. And as we all know, gladly, 2 weeks later, our President, His Excellency Muhammad Buhari, heeded that call and declared the state of emergency to be in place. At the World Bank Foundation Africa, regarding the Niger Delta in particular, we are currently exploring collaboration with Smith Laboratories and Assist International to see if we can put in clean water filtration systems for regional hospitals as a means of bringing safe water to health facilities. I experienced a partnership with the private sector regarding wash and also nutrition intervention is proof that we can build on existing networks, and it is essential to build on existing networks, which is why I welcome all of you for having this road today. A successful national strategy for WASH must show to the world that it has a sustainable framework which the private sector can not only support, but the private sector can lead. We have shown that to reach the responsible people, midwives are ideally suited as the interlocutors to give women, in particular, their own agency and autonomy when it comes to water, sanitation, and hygiene. It's not a coincidence that we have two young ladies in the room who have already started to lead by trying to take water back to their communities. Women are the primary nurturers and the primary carers, and can be seen as the primary agents of WASH. This national strategy, which seeks to use WASH interventions, can also heal the nation by making use of midwives and nurses at the primary level as well as in IDP camps. Those of us who do further research into the conflicts that govern women, peace, security, insurgency, and herdsmen farmer conflicts, we know that the root of those conflicts is pastoral grazing grounds and water to water for others. So women can be disruptive change makers who can demonstrate to local and global partners their ability to implement change. We must, however, have our security guaranteed. I look forward to our discussions today, but I also look forward to swift and transformative change of Nigeria's WASH industry and therefore the health and dignity of our citizens. Our work must be truly bold and must take the best of both local innovation and global innovation to the front lines if we are to succeed. I don't know how many of you are in the same age group with me, but I'm really 55 this year. And there is a song we used to sing in school. I think it was originally sang by the late Bella and Nicolappo Frutti. That song was titled Water in Your Getting. Water is essential to life. Clean water is essential to us ensuring that the lives in our nation survive and thrive. And I think as we gather here today, small group of determined organizations and people who all have individual WASH programs, I think we need to embrace the spirit of collaboration, to join our programs together in focus, if not in technical implementation, to truly ensure that water, will get better for Nigeria. Thank you very much.
We talk about the National Action Plan for WASH. The plan has spanned 2018 to 2030. And in the 3 phases, plan will be carried out in 2 phases. We have the first 18 months to be the emergency phase. Then the next 5 years is the recovery phase. And then we have the last phase, which is the WASH revitalization strategy, where this is a more long-term approach or actions to be taken. And looking at the plan itself, the national plan, it has 5 core areas. You have governance, sustainability, funding and finance, we have the sanitation and then M&E. This sanitation and M&E. For sanitation, we have part of it as a roadmap that was developed for the elimination of open education. So because of the menace of open education, this presentation actually is now focusing on the plan for the elimination of open education. The campaign that the national campaign that is proposed to be able to install the target or the goal to eliminate open education in Nigeria by 2025. So as the background, we have that for 7 years Nigerians practice open education. And so we have a national roadmap to eliminate open education by 2020, and states have also adopted this. But operationalization of this roadmap in some states is slow, even at the federal level. Then we have for achievement of local governments that are now open education free, we have 10 local governments in our currently, and this was period of from 2016 when we had the roadmap to February 2019. Then the rate of achievement is not enough if we are supposed to meet the target. Let's learn from the Indian study is what is made us now to develop this proposal to roll out a national clean Nigeria program to end open education. The study tour that was carried out in India actually brought out this as the outcome of that study tour to be able to have a national program effecting Nigeria stop open education. And the objective of the program is to develop and implement a national campaign, transformation, sanitation, promotion agenda to end open education in Nigeria by 2025, to mobilize and also have resources at the highest level to be able to get the buy-in at the highest political level. From the political level, we take the private sector and also the development partners. Also to create a pool of resource persons, because as we are going to do this campaign, we need those resource persons that will go down to the grassroots to be able to find the masses down to the social responsibility funds, to providing facilities in public places, and determining transparency and accountability mechanisms for mobilized funds. When there is transparency and accountability, I believe that those who are supporting will be willing to continue the support. Then for school children and sanitation, youth children and sanitation champions, we established a school sanitation campaign and strengthening existing environmental health clubs in the schools. And for the program implementation, this program is such that there will be a secretariat established at the national level. We are also hoping that to have the zonal administrative structures, and these structures will be within the 12 river basins authorities all over the nation. We expected that there will be.
I mean, the government, of course, is a major provider for water in Nigeria, and we're providing pipe-borne water, which is the most important thing. But there's also a lot of boreholes and other sources of water. I think the most important thing for the government to do is, first of all, to regulate the sector. Pipe-borne water is how to get water in the 21st century, and so there has to be an effort to really revive all the dams and all the major water sources that we have. But we also recognize that that is not going to be possible in the short run. So we're still going to need the boreholes and the rest of them. The government needs to make sure that this is regulated, because a lot of the quality of the water that comes from many of these boreholes are not necessarily very good, and so that needs to be regulated. In addition to that, the government needs to maintain the facilities, because most times our emphasis is on building new structures. But a World Bank survey found out that 40% of all the water projects done in Nigeria break down in the first 1 year. 40%, that's huge. And so we need to move from just providing new facilities to also maintaining the facilities that we have. And it's also important for coordination. Water is a cross-cutting issue. It has implications for health, for education, for the environment. And these ministries are not talking to each other. To be able to provide the service in a way that, is sustainable and reaches everyone, we need to make sure that all the ministries, are really working together to make this happen. It's fantastic that the federal government has declared a state of emergency. It's fantastic that they have a national action plan, but these need to really be actioned now and really need to be trickle down to the state level, because that's where people live. The states are not being as proactive as the federal government has been, and we really need to make sure that state governments, begin to prioritize water and sanitation, because it's I think it is an embarrassment to Nigeria that in the 21st century we have Lassa fever, we have cholera, we have dysentery, things that can be very easily eliminated, with adequate water and sanitation. So I think there's an emergency. The government needs to see it as an emergency and really needs to begin to prioritize water and sanitation at the state and local government level.
Okay, Alma, in what way do you think the private sector? Wait, practical ways do you think the private sector can
Speaking of the Wellbeing Foundation Africa, we have always advocated for strategic partnerships with the private sector. We do this because the private sector has established structures for doing their own businesses, which can be deployed when you want to have a community goal. One example is our WASH partnership from the Wellbeing Foundation with Unilever Lifebuoy, which aims to reach 2 million Nigerian children with hand washing and soap techniques in 1 year alone. And as we go through the schools, we're already checking what wash provisions we already have in those schools. We have a very big problem in Nigeria with open defecation. And this is why, as we are all seeking to come together to find strategic ways to partner to improve water and sanitation hygiene conditions, we also have to begin to open our eyes to the idea of universal sanitation coverage. As we are putting together water accessibility that we hope will reach local governments and communities, we also have to embrace behavioral change so that, as I say, everybody should be able to have one toilet per person, and after the one toilet per person, we must retrace our steps and remind our health workers, our mothers, our children, our fathers, our brothers, sisters, workplaces, that after using that toilet, you have to wash your hands with soap and clean water. That is one big step that can cause disease to stop in its tracks, and it's something we definitely need for national health security.
Okay, thank you. And for Pind, please conclude a bit.
I'm Teslim Giwa. I'm the Appropriate Technology and Neighborhood Development Manager at the Foundation.
It should be, please. Did we finish?
Because of the cameras. Sorry.
Or will you come here?
Thank you.
Okay. Thank you so much. Because of the cameras. Thank you.
So from your experience, what's the fate of the Niger Delta people in terms of water supply?
Well, the work the Foundation for Partnership Initiative in the Niger Delta does in WASH is largely to preserve the social capital of the people of the Niger Delta. The Pind Foundation was established in 2010 by the Chevron Corporation, and our work is sort of to address the systemic constraints around development in the Niger Delta. We've done a lot of work in that regards, promoting appropriate technologies, especially around water and sanitation. Later on today, you'll be seeing some of those technologies, which looks at the base of the pyramid economics, the very affordable type of technologies that people in this last mile locations can actually afford. We know that WASH, especially things around sanitation, cost the government about 455 billion a year. Poor sanitation costs that much. So our work in the Niger Delta is to work around the 9 states of the Niger Delta, is to make sure we're able to use WASH, which is in the heart of the development work in the Niger Delta, to have that sort of cross-cutting synergy with development work, peace building, and other things around advocacy.
Thank you very much.
I'm Teslim Giwa. Yeah.
Your role
So
I'm the Appropriate Technology Enabled Development Manager at PIND.
My name is Chime Asonye. I'm the Partnership and Engagement Manager for PIN Foundation. That's Partnership Initiatives for Niger Delta.
Okay. How important is this meeting, stakeholders forum that has been held here today? How important is it for the ordinary Nigerian?
It's very, very important. We learned a lot of interesting things today. First of all, we have 60,000 people under 5 who actually die annually based on lack of access to WASH infrastructure. And that's more than we see in terms of Boko Haram terrorism. So we really need people to get all hands on deck. And we know water is a recognized human right. We need individuals to have that access so they can clean, do their dishes, eat. So we want to make sure that we can get these stakeholders together so we can mainstream and scale best practices when it comes to WASH infrastructure.
Okay, so going forward, in another 5 years, where do you think this will take us to?
I think one of the great things that we saw today is that there were some lesson learned and recommendations for how to increase and scale WASH efforts. One of the initiatives that we saw is that PIN, for instance, is adopting market-based solutions as it relates to water and sanitation. Our biosand filter is a means that where we're using a resource, indigenous resources, to get people to do different things. We also saw WaterAid, which was our partner in the event, also using market-based solutions in order to increase. So I think that one of the things we're going to see in the next 5 years has to do with the sustainability of these programs, using more private sector and market-based solutions so we can spread, scale, and give people incentives to try to help these social awareness interventions.
Okay, I know PIND is an acronym. Could you please break it down and tell us a brief about what you're all about?
Okay, so Partnership Initiatives for the Niger Delta. It's actually Foundation for Partnership Initiatives in the Niger Delta, PIND. And we focus our efforts on trying to do social development interventions that are community owned and operated in that region. We have 2 core pillars focused on peace building because we need good security infrastructure and architecture to have economic development interventions. And the second one is economic development interventions because we want to raise people's incomes. And when people are socially mobile and they have money, then you have less conflict. And then we have 2 enabling pillars, an advocacy and analysis, so we work with state governments to try to help with the regional cohesion and environment, and then also capacity building, so we can do trainings and things like that to support business community, private sector, government to try to adopt the ends that we're trying to seek.
Great. Is there any other thing you want to say that I've not touched on?
Yeah, the only thing I would like to say is that when we think about WASH infrastructure, we really need to think about appropriate technologies. So one of the things that we have at PIND is an ATED, which is our Appropriate Technology Enabled Development Practices, and where we model and we test indigenous resources that people can use and support. So our biosand filter is one of them, but we have other different types of things we're working on, and people can visit us at pinfoundation.org if they want to get connected and learn more about what we're doing.
Okay, thank you. On the last note, the water in the Niger Delta, what would you like to say about that as regards this effort?
Yeah, the one thing I would like to say is that a lot of people may or may not know is that we have a lot of riverine, a lot of hard-to-reach communities. So when we talk about working in the Niger Delta, right, we're really talking about working in the most vulnerable and fragile region. So if you can learn best practices here, you can scale them in most places in Nigeria. So it's a really good testing and incubation ground. So we want to partner with individuals to work. The other thing I'd like to say is that I learned today, but we also know that 5 of the Niger Delta, the open defecation areas that are free, local governments are in the Niger Delta. 4 in the Niger Delta, and 1 is in Benue, 4 in Cross River. So we've learned things in the Niger Delta that can assist, and we're continuing to support these efforts in the future, and we want to collaborate with anybody who wants to be involved in those efforts.
Excellent delivery. Thank you. What's your name?
My name is Chime Asonye. I'm the Partnership and Engagement Director and Manager at PIN Foundation, and I'm glad to be here representing my Executive Director, Dr. Dara Kala, today.
Excellent. You spoke well. To tell us how important today's event is, especially to, in the lives of everyday Nigerians.
So the event today was WaterAid&Pind coming together to bring stakeholders in the water, sanitation and hygiene sector together to share best practices on how our interventions are ensuring that no one is left behind and that every Nigerian can be able to access safe water, clean water and decent toilets and good hygiene.
What informed the theme? What informed the theme of today's event?
So the theme, is it fine? Carry on.
Okay, go ahead.
Okay. So the theme was set by the United Nations Agency for Water, and I think it captures the heart of the Sustainable Development Goals, which really is about eliminating poverty. And the lack of access to water, sanitation and hygiene, we believe keeps people in poverty. When people don't have these services, we believe that they stay in poverty, they're not able to be productive. Girls drop out of school when they can't manage their menstruation in privacy or with dignity. So a lack of access to water, sanitation and hygiene has far-reaching consequences. And even in the provision of these services, where government is doing good, we still find that there are marginalized groups that are left behind. People living with disabilities, they're not considered in the design and they're not included, so women taking into consideration, for example, the special needs of women, in the workplace, or girls in school, that they need separate toilet facilities than that of boys. So all these kinds of things, so that's what today was really about, to ensure that we don't leave anyone behind in trying to get access to water across the nation.
And what's your own view?
Okay, so of course I totally agree with her, but then just to add, it's just to show that there's need for people to come together, there's need for more partnerships to be able to address the situation, because one body cannot do it alone, the government can't do it alone, development partners cannot do it alone, so everyone needs to come on board to be able to solve the problem. So today's event was just to provide that platform to share experiences, to share challenges, to share lessons learned, to be able to implement better programs, better sustainable water, sanitation and hygiene programs, to be able to meet everyone and the everyday person, on the road. Like we say, water and sanitation are basic human rights. Everyone deserves to have access to these things, but it's not enough to just talk about them as rights, but we also need to do more, take it a step further from the people, from ourselves, to be able to provide these things for the people and make them responsible enough to demand their rights to these things. Basically, that's just what the event was all about, to be able to find out sustainable, real, practical ways to deliver safe water, sanitation and hygiene to everyone everywhere. Okay, my name is Blessing Sani, and
You have a portfolio?
yes, I'm the Communications Officer for WaterAid Nigeria.
Wow, excellent.
I'm Oluseyi Abdulmalik, Communications and Media Manager at WaterAid.
Wow, women, go girls.